I'm Shanika and I'll be your supervisor. I want to talk about your rights under the BACB Code of Ethics as a supervisee. 5.01 says that you have the right to a competent supervisor. So I should be practicing within my scope of expertise, which I am. 5.06 says that you have the right to receive feedback from your supervisor. So we'll be meeting weekly to discuss what's going well and areas of growth. 7.02 says that if at any time you feel that I am doing anything unethical, you have the right to report me to the board, as you should, because we want to make sure we're not doing harm to clients. So I want to talk about your case. You'll be working with Michael Johnson in his home. Michael has been identified as a 6-year-old boy with limited expressive language abilities. What we know about communication is it is paramount to our ability to function and advocate for our needs. So when we don't have an outlet to voice what our wants and needs, problematic behaviors often arise, and that's what we believe is happening with Michael. So our goal for him will be to increase his ability to demand independently for his wants and needs. An example of this would be Michael saying, "I want Legos." A non-example would be Michael hitting people and then trying to grab out the Legos without manning. You'll be using an FCT coupled with an AAC device in order to teach him this new skill. So in order to teach him the ability to man. What we know about FCT is it is an effective evidence-based procedure that is backed by research. Notable researchers, Duran and Carr, were able to show its efficacy in a study that they conducted in which individuals who were experiencing problematic behavior were taught FCT, were taught behavior change procedures using FCT, and that increased their functional language ability, reducing the problematic behavior. So that's what you'll be doing with Michael. How this will work is you'll be present for 3 days initially in the home just to collect baseline data. We want to see how often Michael is manning independently without any interventions, divided by the number of opportunities he was given to do so. That's going to create our baseline, and then we'll be able to jump right into the intervention. The data for that baseline will be everything that's collected data-wise will be stored off-site so that other treatment team members will have access to that. You'll be using an errorless learning prompt in order to teach Michael functional communication. So how that'll work is you'll be using an FCT device, and you'll see the term. He'll have his preferred item in close proximity. You'll say, "What do you want?" And taking his hand over your hand, you're going to pick up the Lego piece, put it right here on the tab to form the sentence, "I want Legos," and then he's going to have immediate access to his preferred item. Our goal is to do this for 30-minute sessions over the course of 1 week, with the goal of Michael being able to do this independently for at least 3 days consecutively, 80% of the time, in order to meet criterion. You mentioned that you had questions, and I want to be respectful of that. How long should I have to wait to give preferred item? So when an individual is learning a new skill, you want to give them the preferred item immediately. That helps reinforce skill acquisition. What additional resources do I bring for the parents? You'll actually be bringing a functional communication training handout for them, and they'll be able to keep this with them so that they can be able to, once you teach them how to do it, that they'll be able to do so on their own. If parents offer me food, can I eat with them? That's a great question. BACB Code of Ethics 1.06 said that we don't want to create any conflict of interest by forming dual relationships, so just politely decline.